everybody. We are just about a minute after the hour, so we will just go ahead and get started while people continue to trickle in. I know there are still some maybe coming from the lobby or other sessions, but let's go ahead and get started. I'd like to introduce myself first. I'm Shauna Plank. If we haven't met yet, I look forward to hopefully meeting you over the course of the weekend. I live in Denver, Colorado with my husband, and I have a son, Tillman. Tillman is 3.5. He has the ARID1A variant and was diagnosed with CSS last summer. He also was diagnosed with autism spectrum disorder right around his second birthday. So it's been about 1.5 years for us now. And so I also joined the foundation, the CSS Foundation board just a couple of months ago, and have been really excited to be part of a large group effort here of planning this conference. So thank you so much all for being here. We're really excited. Just to make sure we're all in the right place, we are here to talk about autism spectrum disorder and how it affects our kiddos with CSS and who've been diagnosed with autism. And we have an amazing speaker lined up for you. I'll introduce Amanda in just a second. I see hands in the air. So yes, we're all excited. We're all in the right place. That's fantastic. And thank you again for being here. I'm going to run through a couple of housekeeping items. I'm sure you've heard them throughout the day, throughout the weekend. So thank you for bearing with me. Just want to make sure we're all on the same page. So specifically, this session is being recorded. It is the speaker view that's being recorded. So you will not be recorded even though your camera is on, but this is to make it available for others after the conference to either rewatch it or if they weren't able to join us live. Also, Amanda, who I'll introduce in just a moment, will be speaking for roughly 40 minutes, and then we will have time for questions and answers at the end. So I'll help facilitate those questions. So send them away in the chat. You can send them directly to me, and we'll see them as the moderators. And we really would love to have some questions so we can make this as interactive and personal as possible for you as well. So I think with that being said, let's just dive on in. This is a topic that's near and dear to my heart, so I'm really honored to introduce our speaker tonight. So this is Amanda Pharris. You're about to meet. She identifies as she, her, and Aya, and also as a Latinx, able-bodied person. She's an educator, a BCBA, a musician, a lover of all things dogs. So clearly she's just a fantastic all-around person, very well qualified to talk to us this evening. She earned her master's degree in special education and her special education teaching credential. So that allowed her to redesign a full inclusion program in Berkeley in California while earning her BCBA. She works in, out, and around the education system as an advocate, an educator, a BCBA, and now she has her own business as a consultant up in Washington State. So it's called AMP Support Services. So Amanda firmly believes that inclusion is a human rights and social justice issue, and she's thrilled to educate families like ourselves here this evening in school districts in achieving an unquestionable stance regarding what inclusion should and can look like in all aspects of our society. So Amanda, we're thrilled to have you here, and we'd love for you to take it away.
Yay, thank you. You all made it. You made it to the end of the day. We're here. Thank you so much for having me. We are going to be covering a ton of stuff. So I'm going to go quickly. I'm going to try and speak as clearly as I possibly can and get in as much content for you all. All right, let's go ahead and jump in. I'm going to share my screen here. Okay. So we're starting with the basics. This really is the basics of autism, social skills, and behavior. A little bit of background in addition to the intro, which was so awesome. Thank you. This gives you a little bit of context for the point of view that I have. So I supervise BCBA students and special education student teachers, and I'm very systems focused. It's very holistic the way that I approach things, which can be a little bit different from other BCBAs, right, who are strictly clinical or have only been in the school. So I'm a bit of people tell me I'm a bit of a unicorn in that aspect. And I really am a proponent for inclusion in schools. When people ask me if I have my own staff that can come in and can work with them, my response is, you are the staff. You are the best person to be working with your child, and that's the fastest way that your child is going to learn and generalize. So that's sort of the perspective that I come in with. Today, we're going to go over the basics of autism, a little bit of the background, some of the social skills, recommendations, needs for kids that have autism, and the basics of behavior, which, let's be real, it's not that basic. So we're going to get into a lot of it. And then after that, we've got time for question and answer. Okay, basics of autism. First, I want to identify and address that the members of the autism community go by two different labels. And so it's very important to connect with them and ask whether or not they identify as a person with autism or an autistic person. For the purposes of this presentation, I will be saying a person with autism. I am not an autistic person, so I won't identify as that. Additionally, the logo for autism has changed. So a lot of folks see it as a rainbow colored puzzle piece. Well, the members of the autism community have spoken out, and they have proposed that this is the new logo, which I love. It's more inclusive, and it shows definitely a spectrum, right, without an end point, which is more representative of the population. When we look at autism, it's under a larger umbrella. It's under the umbrella of pervasive development disorders. And underneath that, there are different categories. So autism spectrum disorder has the autistic disorder, PDD-NOS, which is pervasive development disorder, not otherwise specified. So welcome to the land of special education where it's alphabet soup. You're going to constantly be learning a new acronym. I've been doing this for 20 years and they always pop up, right? So it's an ongoing process. When we're talking about autism spectrum disorders, the main qualifiers, according to the DSM-5, say that there is a big deficit in the social communication part of it, which is perfect because we're going to be talking about that, right? So there are some challenges. There is lack of social emotional reciprocity. There's nonverbal communication challenges, reading facial cues, reading body language tends to be challenging. That often leads to challenges in developing and maintaining relationships. Another identifier for the DSM criteria are stereotype, or they call it stereotypy, or those repetitive behaviors. And I want to be very clear here that the majority of the time, it is the stereotyped or repetitive behaviors that are non-functional. Right? So we engage in repetitive behaviors all the time. We may sit like this and scratch our face, and we might bite our nails. That's repetitive behavior that may be serving a function. So we want to make sure that what we're looking at is socially significant and that it is functionally significant. There is a lot of insistence on the sameness or rituals, and sometimes we refer to that as rigidity in those patterns throughout the day, what folks eat, the time, how it's presented, etc. Outside of that, you're going to have these other elements that don't necessarily qualify as autism spectrum disorder, but are very closely related and often come up with a dual diagnosis. So that's ADD, ADHD. So those hyperactivity, the intellectual disabilities, right? The lack of attention, those are all contributing, not factors, but considerations for when you're going through to see what autism is. So if we look at it in another very colorful diagram, we've got the autism spectrum disorder. And you can see here that the two big areas are social communication deficits, and then that other area that we just talked about, the restricted interest, insistence on sameness, There are some sensory sensitivities. And then when you break it down even further, this is what is going to be extremely helpful when your child goes into school or is in school. We want to know where they're at intellectually compared to their neurotypical peers. We want to know what their language skills are like, so that when we're looking at those social communication deficits, we know what to target. We also want to look at their adaptive functioning. How much support do these children need? Is it minimal? Is it high intensity? That's what we want to look at, so that then we know how to teach, at what pace, and what's important about us to be teaching. Much like the previous slide, there are some outer sort of connecting other challenges. So anxiety can lead to some of the rigidity and the behavior. OCD can also be related to that. So these are some of those very closely connected diagnoses that may or may not be in relation with autism. It truly is about the brain. Someone who has autism has a fascinating brain. And so if you look at this diagram, what we see in our neurotypical society is people playing together, they get those social cues, they read those nonverbal cues. But what really is the challenge is to take a look at those folks whose brains operate differently, right? They're still able to communicate. It's just up to us to try and figure out what it is. So we're going to do a quick activity, okay? No one has to actually show their work, but I want y'all to start thinking in your own brains, okay? So get a piece of paper, do it in your head, however you would like to do this, okay? So we are going to, this is an example of an assignment that a teacher gave to I believe it was a second grade classroom. And she told all of the students, okay, put the following words in alphabetical order, the order that they come in the alphabet. So I'm going to give you about 10 seconds to put these in alphabetical order, and then we're going to look at something pretty cool. Okay, so check this out. This is how a student with autism answered. Okay, I'm seeing some head nods, right? I'm seeing some, all right? So here's something that I do with teachers. I bring this up and I say, is this wrong? Did they follow the instructions? They absolutely followed the instructions. It's not incorrect. They put them in alphabetical order. It's up to us to make sure that our communication is clear, right? So that's an example of some of the ways that a brain with autism might perceive what we perceive as, oh, I'm just going to write the first word APPLE, and then the next word is going to be FOX, right? So in order for us to communicate with people who think within the box, we need to think outside of the box. It's really important for our language, right? The words that we use. Love is in the air? Actually, no. It is nitrogen oxide and carbon dioxide in the air, right? So being very literal, be clear about the language that you are using. The really helpful language is we, let's, us, our. It shows your child that you are on their team. You want to say exactly what you mean, stick with it. Choices are huge, and give an expectation and follow through. That's that consistency that folks that are really rigid in their thinking need in order for them to become more flexible. That leads us right into the basics of social skills. All right. So there's a couple precursor skills that people need in order to have social communication with others. The first one that I really look for is imitation, right? So if you are asking someone to engage with someone else, there needs to be an awareness that there is someone else there. And that typically starts with imitation skills. Does your child imitate? Are they motivated to imitate? So that motivation is going to be tied in with everything that we are doing with our children. So the imitation skills need to be there so that then when they are motivated, they have the skill of imitating those social behaviors. So these two sort of go hand in hand. It's super important that we work on imitation and that they're motivated. I wouldn't want to engage with someone who is reading about architecture. It doesn't do anything for my brain. However, if you find a motivating way for me to get into that, then I'm going to learn a ton. So it's about that motivation. The other skill that folks with autism need to have is joint attention. And what this is it's shared focus on the same thing by two individuals. Now, that's not me looking at the TV from the living room and someone else looking at the TV from the kitchen, right? We are both looking at an object together and we are shared in that experience. A lot of folks with autism don't have joint attention at the beginning. That's something that can be learned. It's something that needs to be learned. And again, we have to have that motivation, right? A kid is probably less likely to engage in you looking at a piece of broccoli than an ice cream cone, right? So try and get those motivating elements out there. The other element here that is super important is receptive language. This is where so receptive language happens it happens before that expressive language, right? So even in our pre-verbal parts of our development, we hear different sounds. Then we start making connections to those sounds. And after we make those connections to what we hear or what we see, through the skill of imitation, through the skill of labeling, then we learn how to expressively state. I like it, I don't like it, I'm labeling it, I'm requesting it. I want to be very clear here. This does not mean that it's just verbal expression. You can use a communication output device, right? You can use sign language. Whatever it is, that expressive part comes secondary. There has to be that receptive skill first. So if you tell your child, hey, come on, let's go, you need to stand up, and they stand up, boom, you know by their behavior, by their response, that there is that precursor skill of those receptive language skills, which then can move towards that expressive language. Okay. The last thing that's really important is called theory of mind. This is when one person has the ability to acknowledge the mental state of another person, right? So after we go through the imitation, after we go through that motivation for being interested in what someone else is doing, then we have to teach that our brain is not the only brain in the world. And just because we think this way doesn't mean that every other person thinks this way. It's a hard concept to teach. It's absolutely possible through very clear and explicit instruction. But it really needs to happen, because without that, you're not going to have that ability or the interest to engage with another person. You have to be aware that that other person has their own thoughts. And that's what theory of mind is about. Because if you're going to engage with someone socially, you can't just keep your thoughts and think that your thoughts are the only way. There's a lot of compromise there, all right? So when these precursor skills have been established, then we look for opportunities to use or generalize them. I'm going to play 2 quick clips, but when we look at the theory of mind and everything coming together, we want to provide opportunities for exposure. Early intervention is the best intervention. Get your children exposed to their neurotypical peers, right? Get them out there. It's also fantastic for their same age peers to be exposed to people of different abilities. This is a video that I want to show of a full inclusion program that I worked at in Berkeley. This is really to show how impactful it is for children to be around their peers. Charlie is a young boy who came to us for about 4 months from a different country, and he had always been in a self-contained classroom and had never received any academic instruction. He has cerebral palsy. He has a seizure disorder. He has autism and a couple other things that are going on with him, and he's nonverbal. So this is him out on the playground. He had never been around peers before, didn't know what basketball was, didn't know what soccer was. And so we just were there to support him and faded back as much as possible. Watch what happens with the peers as he's okay, that's one really cool video. Here's another one. So these students were not told to do that. We modeled for them. We allowed Charlie to have exposure to this. Within 3 weeks, he was walking up and down the stairs independently with his peers. And we found out that he was an amazing mathematician and was doing triple-digit division in 3rd grade. So give your children the opportunity and push for it. That is my encouragement. Whoops, sorry about that. Okay, let's see if this works. There we go. All right, moving into the big one, behavior basics. All right, I want everyone, as ridiculous as it sounds right now, to repeat after me and say behavior is communication. Okay. All right, I love seeing those mouths go. Okay, we're gonna do it again. After me, say behavior is communication. Fantastic. All right, one last time, 3 times, we're bringing it in. Behavior is communication. Fantastic. I love how involved and engaged you all are. Thank you. This is something that you're going to repeat probably every day for the rest of your life. At least I hope so, right? So we need to understand that when we're looking at behavior, it is communicating something. We just need to figure out what it is. So a child's behavior does not always seem, or is not always what it seems. There's so much below the surface, right? So we don't know if the reason that they're engaging in this behavior is because they have a hard time with executive functioning. We don't know if it's because they're hungry and they haven't eaten for 4 hours. So many times there are these contributing factors to the behavior. And we, as the people who are working with those who are behaving, need to figure that out. So what I do with behavior analysis as I figure out what's going on with the behavior. It's a natural science, and it studies the relationship between the behavior and the environmental events. Now, ever since COVID, I have become quite the plant behaviorist, right? So you can become a behaviorist, really, and work with any living organism that behaves. Right? My plants behave. They turn yellow when they need more water. Okay, they're communicating something to me. It's a living organism. Same thing. I love dogs, so I mean they're amazing communicators too. When we have these living organisms, that is what we're looking at, that communication through their behavior. And it can be verbal and it can be nonverbal. Here's something for you to think about. When we are addressing or working with challenging behaviors, okay, I'm putting that in quotes, we need to think about, who are they a challenge for? Because if they are a challenge for the behavior, they're likely not going to engage in that behavior, okay? It is usually a challenge for us, okay? So we want to think about, why is it a challenge for us? And I'm going to go back to what I said earlier about there needing to be socially significant reasons for this to be a behavior of challenge. Is the behavior of challenge functional? So take a look at those two pieces. If the behavior is functional and you just don't like it, then we're going to have to try and work out a compromise, right? If the behavior is functional and it's not socially significant, for example, if a child has a headache, right, and they're trying to indicate that they've got pain and they're knocking on their head, that likely is going to be socially significant when you're out in public, right? So it's a matter of, what behaviors do we need to address that are impeding the social aspect of it? What are those behaviors that are impeding the functionality of what they could be doing otherwise, okay? The other thing that we want to think about is the cultural considerations, and that's not just based on state, community, it's also based on school. What's the school culture? What's the preschool culture? What's the culture with my family and the way that we communicate, right? So, and the way that we respond to behaviors. Another thing, I'm going to go back to it again, early intervention is the best intervention, okay? That's not to say that if your child is 16 years old that it's too late. It's never too late. We're always developing. We're always learning. At least I would hope so, right? And consistency is key. We have to know what to anticipate. The consistency on our end in responding to behaviors is extremely important, because the behavior needs to know where those boundaries lie. So it's up to us to respond to those behaviors consistently. Okay, we're going to get into the ABCs of behavior. So when we look at the ABCs of behavior, it's what they call a three-term contingency. So the antecedent, which is the trigger, right? That is what happens immediately before this behavior. So you want to figure out, what's the behavior, okay? So is the behavior socially significant? Is the behavior functional? What is that behavior? And I'm talking about explaining the behavior or defining the behavior in concrete terms. So when I go into schools and the teachers say, he loses it, what does that mean? What does loses it mean? Oh, my child, she just shuts down every single time. What does shut down mean? So we have to be very specific about how we define the behavior. The behavior is closed fist, raises it back behind their head, and makes contact with a person next to them with enough force to make a sound and to leave a bruise, right? We want to know exactly what the behavior looks like. That's where we start. Okay, what's the deal? What's the big behavior that is giving us those challenges? Once we know what the behavior is, then, this is going to sound really strange, forget it. Because we already know the behavior is going to happen. It is what it is. What we need to focus on is what happens immediately before and immediately after, right? And I'm talking immediately. So often when I go, I'll use another school reference. When I go into schools and I say, okay, well, what was the response? What was the consequence? Oh, he had to go home. That is not the consequence. That's not the response. The response is, or the behavior is, student verbally protested in classroom. What was the response? The peer laughed, or the teacher came over immediately. That's the immediate response. What happens immediately after? because you don't want to talk about them leaving home because there are a number of behaviors that could happen until that point. So you want to be very clear what happens immediately after. The other thing we're looking at is what happens immediately before. What are the triggers, right? So this is where you all become the information, right? So we see the antecedent as, okay, we got this timer and we know that it's going to go off. We need to figure out what are the elements of that, how much time is left on that, where is it placed, right? And then we look at the immediate consequences. What are we doing as our response? And I want to be very clear here that a consequence is not bad. It should be the response. So this really should be ABR, right? Antecedent, behavior, response. Consequences are not punishment. It's just the response. And it's important for you all, if you're having a challenging behavior and you're not understanding and you say, oh my gosh, it came out of nowhere. Behavior never comes out of nowhere. There's always a reason for behavior. So the antecedent, some of the things that you want to look for are how much time has your child been not engaging in the behavior, right? Or how much time has the child not had their most highly reinforcing item that they typically would engage in barrier behavior to get. We need to figure out that when the function isn't, when it's not met, what is that function? What are they talking? Why are they engaging in this behavior? What's the need that we need to meet before they engage in the behavior? A lot of setting events. I had a student who every time it was windy outside, oh, good Lord, he'd give me a run for my money. Those were things that were outside of my control. I couldn't control the wind, right? But I did have to take into account that, hey, on windy days, he's probably gonna have a really challenging time. Changes in the environment, a new substitute, a babysitter. Hey, we're not going to go to that park because it's closed. We're going to go to this park, right? Those changes are really important to take a look at. Then the consequences. So what happens immediately after that behavior? This is the why, okay? So the antecedent tells us when, the behavior is what, the consequences are going to tell us why. And if we look at the consequences, there are three different aspects of a consequence. So it means that it is either going to be maintaining the behavior, it is going to increase and reinforce the behavior, or it's going to punish the behavior. So anytime there's a behavior and you have the response, it's going to do one of those three things. Okay? Reinforcement means that it's increasing, right? It's positive reinforcement. That means you've added something and the behavior increases. Negative reinforcement, you take something away and the behavior increases. Anytime you hear reinforcement, it's an increase. Okay, once we figure out what the antecedent is and we figure out what the consequence is, because we already know what the behavior is, then we come to the really cool part. What's the function? Well, every time they engage in this, I give attention. Okay, well, check it out. There's 4 functions of behavior. It is either access to or removal of, escape, attention, tangible, or sensory. And sensory, you'll hear automatically maintained behavior is another way that folks refer to sensory. That's something that is specific to that person, and it's something that they can do within themselves. That is that regulation piece of it. So when you figure out the function of the behavior, then it's about managing the behavior. And you're not managing the behavior, you're really managing the antecedent and the consequences, because depending on the antecedent and depending on the consequence, the behavior is going to shift, right? If the consequence is, oh my gosh, I know every time I do that, this is what the consistent response is, I'm less likely to engage in that behavior. Or before the behavior occurs. Oh my gosh, I used to have a client in the clinic, and when it was 10:23 on the dot, she was hangry, mad hangry. And so I would always tell my therapist, hey, at 10:22, break out those goldfish. Like, we're going to do counting with goldfish. We're going to do subtraction and she eats one. Like, so be aware of those, but that's really that clue in, that cueing into, when does this happen? That's where you are those data analysts, where you're gathering all of that data and figuring out, okay, I see some patterns here. The antecedents, once you figure out, you know what, this happens however often, it's when you set up that environment for the behavior, it's going to be less likely to occur when that antecedent management is a part of the cycle. Again, the consequences either reduce, they maintain, or they encourage the behavior. What's the outcome of the behavior? What is my behavior getting me? So we want to change the antecedent and the consequence consistently. It's got to be consistent. It's not, I engage in this behavior, oh my gosh, I'm going to do this now. If you respond in one way at one point in time, be prepared to respond to that behavior in the grocery store, at the park, in the car, wherever you're going. There needs to be consistency in responses to those behaviors. That's going to change the level of intensity, what the behavior looks like, how often it happens, and how long it lasts. When we meet, let me back up. After we identify what those triggers are, what comes before the behavior occurs, and when we figure out what are the consequences, what is happening that's maintaining the behavior, or what's happening, oh, every time this happens, I'm noticing that this is happening more often now, right? Or this is the response, hey, check it out. The behavior didn't last quite as long. Pay attention to those. We need to, once we figure those two out, meet that function. So what's the function? Are they trying to escape? Do they want attention? So often you want to meet the function before the behavior occurs. If I know that every time I slug my brother in the back, mom's going to come around the corner and say, what are you doing? And I just wanted her attention, I'm going to do that to my brother more and more and more. However, if we notice, hey, after 2 to 4 minutes playing with brother, it's really hard, and it's a lot of social stuff going on, and we're trying to navigate. And we know that at that 4-minute mark, we start to get physically aggressive. We shift at the 3.5-minute mark. And then we teach those behaviors. Hey, do you need a break? Remember, we keep our hands to ourselves, right? Then we have to teach the replacement behaviors that meet that need. So if I hit my brother in order to get mom's attention, then what is it that I can do instead of hitting my brother to get mom's attention? I can call her name, right? I can go up to her and I can say, hey, I need a break. Brother can go over to mom and be like, something's up, and leave the situation. There's tons of ways that you can work with it. We have to meet the need. What is the function? And you meet it before it occurs. If your child has been taught, I hear this a lot from teachers and parents, like, oh my gosh, I don't know how many times we've gone over this. They should know this by now. You should know this by now. Let me tell you something. If they're not engaging appropriately, they likely don't know, or they're not motivated. We have to continually repeat. That's one of the things with autism. Get into the structures, the routines, and repeat those elements. Teach it again and again and again. Keep your expectations high. I can't tell you of any client where I have ever said, like, I don't know, I don't think that they can do it, or where I've never been surprised by a client. They are incredible people. They have amazing brains. So keep those expectations high, because they'll rise to meet them in their own way, right? We may not have somebody who is a World Cup soccer goalie, right? But in another way, they may be shining in their own capacity. So keep those expectations high. They know that you believe in them, and that's so powerful. And celebrate those wins, right? We have to keep those wins because that's the reinforcement. Oh my gosh, you did that? Unbelievable, right? And be okay with their responses. I'll give an example of a praise that I gave to one of my clients. I was in home with him, and I looked at him and I said, buddy, you are blowing my mind. And he crawled right over to me and he just spit and blew all over my forehead. And I said, that's exactly right. Blowing my mind, right? But it was great. And then after that, we went right back to that previous behavior skill that we had been working on, and he totally mastered it. So it's really important to have those relationships and praise those teeny tiny moments. Look at those and be excited about those. Really, I want to give a ton of time for questions. I know I ran through a ton of this really quickly. I do want to thank you, and I want to thank your children. If it weren't for their amazing uniqueness, we wouldn't be here, right? So thank your children and appreciate who they are, and continue with what you're doing to respond to the behaviors, the challenging behaviors. Just keep it going. Keep it going. It is a hard job. We are out there. We are here to love you and support you. Get on board with your school team. Get on board with your specialists and connect them. Holistic is so much better. You don't have those fragmented pieces. That is so key and so important. All right, hit me with your best shot. What questions do we have?
Thank you so much, Amanda. That was fantastic information, and how nice to wrap up with reminding us how amazing our children are. We know that, and still I think we find the world sometimes underestimates them. I know I do, and he always continues to amaze me. So what a nice message. Thank you, Amanda. We do have one question here for you, specifically about looking for therapists. So the question is, what are some red flags that we should look for when finding a therapist for our children? This particular family had someone tell them that they should eliminate their youngest child's stemming, her hand flapping. So at what point should they remove their child from, a situation like that they're not very comfortable with, and maybe look for another ABA facility or other type of therapy?
That is a fantastic question. And unfortunately, it's a challenge that so many families face. What I would say is be very, very clear. Be clear with your therapist. From the get-go, figure out what their approach is, right? So I use behavior analytic practices. It's very different than a lot of clinicians do. It's very different than a lot of special educators do. So a lot of it is kind of like, I can't believe I'm going to say this, but it's like dating, right? So you go on a date, you figure out the information, you give your information, and you see if it's a good fit. Certain therapists are going to be a better fit for others. The other thing that I would encourage you to do is research. So if this therapist is recommending something specific about it and you don't agree on it, go to the research, right? So behavior analysts have an extremely high code of ethics, and we've got to constantly be up on the research. If we are giving you something that is outdated or wrong, that's your red flag. Then you go to whatever organization that you have that BCBA, see if there's another BCBA. I wouldn't discontinue services unless it's really going against and you're not seeing any progress with your child until you've got something else lined up. You want to make sure that at least you have some tools, if you don't have that provider, to continue with those challenges and those skills, that skill acquisition, until you get someone else who can come alongside you. You are on mute.
I was muted. Thank you. Thanks, Amanda. And that helps us with, our children tend to receive multiple different types of therapy. And so that's really great advice. Thank you. One question I want to start with here is specifically about a 13-year-old girl who's not diagnosed with ASD. However, her mother believes that she may have it. So who should she see? A neurologist? She did see a neurologist years ago and was not thought to have it then. And this might lead to more questions about girls in particular. We know girls are underdiagnosed. There's a lot of masking going on, so that you may be able to elaborate on that as well, but starting with kind of where do you go when you think your child might be autistic?
That's another great question. I love these. So if you suspect that your child has a disability, if the school suspects that your child has a disability, by law, they are required to take the steps in order to go through the referral process. It's called child find, okay? And what I would do, so there's two different ways you can go about it. You can go the private way, and so you would go to your primary care physician or your pediatrician and say, hey, I've got all of these really big concerns. Here are the areas in which she's really struggling or she's not progressing, right? So start with there. Also, go to the school and talk to either the special education teacher, talk to the person who is in charge of your the counseling services, your MTSS, multi-tiered system of supports, your cost, it's a team for when you need to do like referrals and go through interventions, your response to intervention team, whatever your school has for those different tiers of support for the tier 2 and tier 3 supports. Talk to the teacher and say, hey, where are the challenges? Are you seeing the same challenges that we are seeing? I work in a lot of schools where the parents are like, my kid, I'm definitely concerned. And the school's like, I don't see it. We don't see it. And so then it's very clear and very evident that there is a difference in behavior and environment. So that's something that you want to take in. So you talk to the gen ed teacher, the counselor, the school psychologist is likely the one that is going to be doing an evaluation if the school agrees that that's the route that you are going to take. Often what happens and what should happen is there should be a session of intervention periods. So, hey, we're going to meet with our team. Here are the different interventions that we can do to see whether or not, diagnosis or not, this student needs extra support. If you get a diagnosis from your doctor, or if the school figures out that, yes, we are qualifying your child for special education services under the eligibility category of autism, you want to make sure that those two are connecting as soon as possible.
Thank you, Amanda. Great. We have quite a few more questions coming in. I want to start with one specifically that may come up for if anybody's following on social media, like autistic adults, or you're connected with any other autistic adults. There is some discussion about ABA and how there's awareness, or maybe it's changed a lot, but how much has it really changed? So I think we should just put it out there. And can you talk about, what things we should be watching out for as we do seek that type of therapy for our children?
Yes, thank you. This is the elephant in the room that so often people won't touch. So with ABA, it's a field of study, right? It is a science. And so when you're, again, just like I was talking about before with the therapist that is not quite the perfect fit, you want to find somebody who you can see and understand and who can explain to you why they are doing what they are doing, okay? So ABA has a bit of a bad rap. When you look back, it comes from the clinic originally, and it's very discrete trial, right? These trials after trial. So if that works for your child, go for it. Some children really respond to that. Hey, I know I'm going to sit down. Yep, I've got the routine going. Make sure that whatever they're learning within that capacity, that they're generalizing, right? We want to think what's long-term for our children, right? They're not going to be in a clinic for the rest of their life, right? So there's that aspect of ABA, right? The very clinical, more rigid. I will say that there are more and more BCBAs out there that are challenging others in the field to be culturally responsive in their practice, to be listening to the child's voice, right? So often ABA is perceived as this adult comes in, they have their program, and the kid's gonna do it. That's what the adult says, right? Make sure that you find somebody who listens to you, who works with you, and who can collaborate with you. They do not always have to agree with you. I don't know how many families I say, I'm going to tell you something that you likely don't want to hear, but hear me out, right? And then we compromise, and the families say, actually, no, that's not going to work for our family, but we'll do up to this point. Awesome, right? So when you're looking at the field of ABA, yes, we have done it wrong in the past for certain people. On the flip side, you've got unicorns out there who take in a very holistic approach, right? They work with the SLPs, they work with your OTs, they work with the school team, right? And so that's a different aspect of the behavior analytic practices. And behavior analysis is not just working with that particular child. You're working with the parents. We're shaping the behavior of the parents, right? So yes, ABA can be controversial. And yes, I have looked back and been like, you know what? That kid totally learned it that way. But looking back, that wasn't his style. He probably could have learned it faster if I had done something different, right? So find a BCBA or find somebody within the field of behavior analysis that's reflective on their own practices, right? And again, look at the research. Speak your truth. Ask those questions. Speak on behalf of yourself if you have autism, or your children if they have autism.
Thank you, Amanda. I think it's really important to address that narrative and appreciate your perspective on it. You know, as special needs parents, there's so much information out there, and it's like, how do we navigate, you know, all of these different stories that we're hearing and how they apply to our family? So what I'm hearing from you is you're in charge. So take charge and do what makes you comfortable, and don't do what makes you uncomfortable. So thank you for sharing that. Another question that we had is, this family, their daughter's petrified of water. So, you know, when it comes to bathing, they've tried full body medical wipes, dry shampoo, but I mean, frankly, she needs a bath at times, right? So how do we balance what's needed versus sensory issues? I'll throw in my own perspective. Nail clipping is a huge nightmare, and I dread it and try to leave the house and make my husband do it. How do we balance some of those basic needs that are just not optional, maybe getting in a car seat, with, you know, the challenges that our children have?
Mm-hmm. That's ongoing. And what I will say is it's going to be different for every child. So the main aspect that I look at is motivation, right? Motivation and pairing. So if the child always thinks that water means bath, then it's going to be bad no matter what, right? But let's say that we start off and the child has a sugar sweet tooth, right? So we start giving droplets of water that's soup like Kool-Aid or punch, right? Hey, check out this water. You start positively pairing it. We start way over on one end, knowing that we have a long way to go. But that's that consistency part of it, right? Hey, check it out. We've got water. Hey, look, we're splashing in the water. Oh no, I got wet. And then leave it, right? Then we're going to say, okay, she touched the water once. It lasted for 5 seconds. That's baseline. Then the next day, you may touch the water twice and leave it running for longer, right? And then you move up from the hand to the arm. It's very systematic in the way that we are bringing people to engage in something that's highly aversive. So in order for something to become less aversive, something else needs to become more motivating to draw them towards that. That's where that motivation piece comes in, right? If every time I see the nail clippers, I freak out and I run outside of the room, Then, hey, maybe we get a different set of nail clippers, right? And we start pairing it with something that's highly reinforcing, right? Like, hey, hold these for a second. My hands are full. Awesome, you held it. You drop it and you don't touch it for the rest of the day, right? So we start with those very tiny movements because it's eventually going to snowball. Again, go back and celebrate those little milestones. Don't, oh man, he didn't let me clip his nails this time. Well, did he touch the clipper? Had he done it before? Great, we're making progress, right? So when you're thinking about these things that are highly aversive, think about addressing it systematically and about addressing it with reinforcement and pairing with the positive.
Thank you. Great. I did hear from at least one other family who struggles with that too. So this is really great practical advice. I've also, I'll add, I've had success clipping nails with our ABA therapist. Doing it at home, I think some aspect of that's helpful. So if you have a great therapist on hand, certainly make that part of the routine with them. And the more, I think part of it is also for us as the parents. Like I mentioned, I run away and make my husband do it because I'm scared. And probably my son, like Amanda talked about, is going to do a lot better than I imagine. But one experience, and that's what I have in my head too, of, oh no, it's going to be these tears and I hate having my son cry. So the more experience you have, even if it's one nail at a time or one toe in the bath, you know, those will hopefully become more and more what you remember.
I love that you brought up the element of difficulty and avoidance as adults, right? Even, I mean, I've had my fair share of challenging children, right, that I've worked with, and it's like, big breath, I'm going to go in, it's going to be a lot of work, right? But the one thing that I will say is it is so worth the hard work now. Do it now when they're little. Get in as early as you can. The early intervention is the best intervention. And if something comes up, address it right away. And yes, it's going to be hard. It's going to be much harder if that behavior is maintained or reinforced, right? So it's you put in all the work here so that you don't have to put in 3 times the work because you've avoided it for a month.
Great, and the time will pass regardless. So you know, it's ideal to get to the end of that time and have accomplished something like that. That's great. This next one, I don't have any experience with, but I'm sure many of you do, is specifically when a child is having some sort of aggressive behavior towards another child or a sibling. So they're punching their brother or hitting them or something. Is it better to remove the child who has ASD, remove the other child? It's kind of a fine line because you don't want to reward the behavior, looking at kind of what the consequences, but also everybody needs to be safe. And obviously that's not, we can't tolerate behavior like that.
Yep, absolutely. This is a tricky one, particularly in schools. But what I will say is, what's the function? Is the function to have brother removed? If that's the function and it happens every single time, don't remove the brother, right? So what we need to do then is, if you're not going to remove the brother, or if it's avoidance of brother, we need to teach the tolerance of. So then it's looking at the antecedent, right? So, okay, we've been sitting here for however long, and the kid doesn't know how to tell the other peer or sibling, hey, I need my space. Hey, I need a break. Hey, I want this, right? So then we have to teach the functional communication for the function of the behavior, right? So if it's, I need to be by myself and I start slugging people around me, give me that replacement behavior before I slug that person. It could even be like, all right, I'm in the wind up, right? Someone comes in and says, do you need a break? Let's take a break. All right, gosh, you said you needed a break. Boom. And then they remove them, right? Like, and it's very much like, you're kind of like, okay, when's it going to happen? Is it going to happen now? Is it going to happen now? Is it, boom, there we go, right? So you have to be a little bit on your toes and be very aware of the patterns, right? So when does it happen? When doesn't it happen, right? And what's the function of it? The removal is either going to reinforce or it's going to decrease that behavior depending on the function, right? If the function of the behavior is that you want to see little, or that you enjoy seeing little brother cry, then you're going to need to remove the little brother, right? Because then they're not going to have access to the function for that behavior. So it really is trying to figure out what's the function. Okay, if I remove brother, does the behavior increase the next time? Does it happen more frequently? Does it happen with more intensity? And does it happen faster, right? Or sooner, in order to get the brother to cry? It depends on the function. It really is. You got to sit back and figure out, okay, if every time I remove sibling, this increases the behavior or decreases the behavior, then you go to the antecedent.
Thank you, Amanda. And you know, we just wrapped up, my husband and I, a course with our local children's hospital looking at the ABCs for 8 weeks, and it was fantastic. And one thing that this question came up quite a bit, and we can apply this to neurotypical children as well, right? We're talking about in the context of our children with ASD, but every child has a behavior that's kind of undesirable, possibly. And so this would be a time when you could also look at that, of what's happening with the sibling or the other person who's involved in this behavior, right?
Mm-hmm. The thing to think about when we look at antecedents and consequences is they're all around us every single day. If I show up late to work every single day and I still get my paycheck, what are the chances that I'm going to continue to show up to work late? Probably pretty high, right? Now, if every time I show up to work late, it gets docked on my paycheck, what are the chances that I'm going to show up late? Probably not as likely. Okay, so they're setting up the expectation as the antecedent, but those consequences are what are going to tell me whether or not my behavior is going to increase, maintain, or decrease.
Great. Thank you. And I know we are coming up on, or we're at time now. So if any dads want to hop over to the dads event, you're welcome to do that. We do have one more question I'd like to end on, and then Amanda has very kindly offered to stay on extra if there are any other questions that come up from anybody. And just a couple comments. Great presentation. So thank you. Those are coming through as well. One question is, if I want someone like you to help my child, how do I find someone?
Okay, that's a tricky one. Okay, so there are a couple of routes, and it's different per state, and it's different per county, and it's different per country. So if you want to find an ABA therapist sometimes, or a BCBA or an educator, there are a couple ways that you can go about it. You can go through your insurance if you have insurance. You can go through a regional center, which is usually within the county or the state. Different states have regional centers, different states do not. There's also, you can look, I mean, it's kind of hit or miss with, hey, I'm going to Google these clinics around me and I'm going to take my chances. It's kind of like going to see a doctor, right? You go in and you see a doctor, that intake, and you're like, man, they had terrible bedside manner. I'm not going back there. Then you go and try another doctor, right? Or a doctor who's like asking you all kinds of questions and you just doesn't make you feel comfortable, right? So it's a matter of figuring out what that fit is. So I would look at your local community, see if there are people in your community that have a therapist that they really like, a clinic that they really like. Talk to your doctors. Your doctors are also going to be really great at, oh, hey, I've heard that this clinic does really well with this clinic does really well with this. Talk to your educators. Certain districts are going to be very different than others. When I worked in California, if a teacher or if a parent asked a teacher, hey, do you know anybody who knows ABA or BCBA? Almost everyone in the district was like, yeah, actually, here's this list. Up here in Washington, it wasn't like that at all. It was like, ABA what? So it kind of depends on where you're at. I would say get hooked into as many community people that are as closely tied to you. Talk to people in your church. Talk to people who go on your play dates, with you. So it's amazing what happens when you just start asking questions. So there's not a streamline sort of step-by-step guidance to finding somebody. It's just really a matter of where you're at and what resources you use.
Thank you. Great. And also trying things out, and if they don't work, that's okay, right? Are you ever offended? I'll just ask a follow-up question. If you're with a family and they tell you, you know, this is just doesn't feel like the right fit for us. I think people are scared to say that.
They are. And you know what? Here's the thing. If you don't say it early, you're going to be delaying the potential of some really awesome progress with someone that you could connect with. Use your voice. I have had families that are just, man, don't refuse to do this, don't want to do this, don't see eye to eye, don't see eye to eye. And so then it's a matter of saying, and I've had conversations, particularly with high school parents, hey, when we're working on this and they come home, here's the contingency plan. Are you able to follow through with that? And if the parent says, absolutely not, there's no way we can do this, then I quite frankly say, okay, then we're kind of at an impasse here. So where do you want to go from here? Make sure that the person that you're working with is not fighting against you, but fighting with you to the benefit of your child. If you have somebody who's skilled in their work and someone who can put their pride on the shelf, you're going to make progress with the right person that's that fit for you. I haven't been offended by it. I honestly don't know if I've had any families who haven't, but you know, I love hard and I go hard and I do right out the gate. I say, I'm likely going to tell you something that you don't want to hear. I get it. It's hard. We're gonna do this together.
Thank you. Great. And we did have one more question come in, so I appreciate you hanging tight with that.
Yeah.
So this mom, her daughter has symptoms that are in line with ASD, but not severe enough or not having enough support needs required to actually be considered as on the spectrum. So they'd like to revisit as she becomes older and social relationships become more nuanced. Right now, they're quite strong, her social relationships. So would you have any advice, services, or early interventions that may aid this family along the way?
I would talk to, well, it depends on how young the child is, right? So when we go back to the exposure, right? Get your child exposed to as many neurotypical peers as they possibly can, right? And really be explicit. When you find a deficit or you find that your child is always upset because when they walk up to a group of people, the people don't turn around, right? You have to teach them, hey, we got to tap them on the shoulder because your brain is not their brain. They don't see you there. They're looking this way and you're coming up here. So having those explicit conversations based on the area of deficit or based on that skill that you are seeing that they don't have. So as you're working through that, as you're coaching through that, be recording that. Hey, we've had conversations here. We've tried play dates here. We've done this. So that if for some reason those gaps grow bigger as she gets older, and then it becomes more of, oh yeah, you know what? We're definitely seeing something here. You want all of that information for the school team, for your doctor to say, here's everything that we've tried. Here's the progress we've made. And now we're hitting a wall. The more information that you have, the more documentation that you have, that's going to speak volumes for then moving forward beyond that.
Great. Thank you, Amanda. And you know, one follow-up thing I thought of is I've heard many times, so usually when you get an ASD diagnosis, it comes with levels. So levels 1, 2, or 3, you know, considered somewhat mild, moderate, severe, for those kind of 3 different categories. But I've also heard that's where your child is in the moment. If you did the same assessment 2, 3 years later, it might be very different. So has that been your experience, is that as children go through therapies and grow and learn, sometimes their level of needs may go up or down depending on, you know, what they're experiencing at the moment?
Absolutely. And it's not just the overall need, it's within the specific skill category, right? So one may be communication, one may be imitation, one may be social, one may be labeling, one may be daily living skills, right? So as your child is progressing through, they may be making a ton of progress in one area and this other area just didn't happen in, right? And then all of a sudden, things start leveling out, right? So it's kind of, it's an ever evolving, ever moving plan and part of your child, right? I mean, I know for me that my behavior fluctuates, right? So there may be days where I am rocking it with my physical fitness, but spending time on another aspect that I really need to develop on with this book, I'm just like, I haven't touched the book in however long, right? So it's a matter of like knowing that things will ebb and flow, things will change. That autism diagnosis may or may not fluctuate. I've had students who all the way through 18, yep, you've got ASD, we're still giving you services for that. I've also had students where, hey, they hit 5th grade, going into 6th grade, hey, you know what? You're not eligible for special education services anymore. You still have ASD, but you don't need that extra support because all of those skills that we've taught you, now you're able to generalize, right? So it's a matter of getting those skills to a point of generalization. And once you pull back with that independence, your kid is going to take off, but it does require a lot up front and it will change. Absolutely.
And as we speak of different levels, a term that we hear used a lot, and I've actually heard myself that maybe it's not an appropriate term to use anymore, high functioning autism. What's the take on that right now?
So yes, that is where a shift is coming. So we're moving away from low functioning and high functioning to needs based, right? So they have a high level of need, right? They have less level of need. They have the needs in the area of, right? So we're looking less at what they can or can't do, and we're looking more at what their needs are that we need to fill in there. So it's a little bit different in the term, but yes, low functioning, high functioning, it really is coming from the autistic community. Don't tell me how I'm functioning based on what you think, right? So it's a matter of here's what I need instead of that perception from other people placing that label on there.
Great, thank you. We don't have any other questions unless anybody wants to put anything in the chat. Anything else for Amanda here? Amanda, we really appreciate your time.
My pleasure. Would it help if I don't know how y'all are doing this, if I gave somebody my email address in case questions did come up, or is there a platform for y'all? What would work best for you?
That would be great. If you want to share it, well, actually I have it, Amanda, already. So if you don't, what we could do is I'll put the foundation email address in the chat box, and then anybody who wants further information, you all already have a copy of the presentation. It was put in the chat earlier. If you didn't get that, just send me a message and I'll make sure you have it. But then anybody can email me and I can connect them with you, Amanda, via email if that works for you.
Yep, absolutely. I'm also going to drop it back into the chat. Oops, hold on just a second.
Awesome. Thank you very much.
Okay, this should be, it's a doozy of a presentation, so it might take a little while to download once you get it, but it's coming through.
Well, thank you so much. I'm not seeing anything else come through, and looks like your presentation just came through again. So if anybody wants to continue chatting, you're welcome to hop onto the ongoing thread that we have, the lobby, if you will. I can put the thing in here, and we'll give Amanda the rest of her Saturday evening back. She is on the West Coast, so still has time to go have a little fun while some of us might be going straight to bed. One question just came through of whether this is being recorded. Yes. So the recording will be shared at some point in the near future as well.
Great. Thank you all so much for having me. This is such a delight, and I'm so honored to be a part of this. So thank you.
Thank you so much. Have a great rest of your day, everybody.